Hi, my name is Valdo and I'm going to be showing you how to change a chest tube dressing and to start a heparin infusion on a patient. So I have an order to change chest tube dressing. So as I enter the patient's room, I'm just going to wash my hands. So I'm just going to wash my hands here. And then I will be scanning for any safety around. I see there's no safety. The patient is in good condition and there's no safety. So I'll just first put the bed up at my waist level and introduce myself to the patient. So hi, so my name is Valdo, I'm a student nurse and I'm going to be changing your chest tube dressing, okay? So I'm just going to put up your bed here, okay?
I can suction and then I'll check the top pressure.
I'm just going to put the patient's bed up to my waist level.
Nearby, in case.
And then I'll just raise the head of bed a little bit. And also to make sure I have the right patient, I'll just check with his armband to make sure that I have the right patient. So sir, can you please tell me your name? So Holmes Wendy, okay, and can you tell me how old you are? 25-year-old. So I'm just going to double check that field number 1, 2, 3, 4, 5, 6, 7, 8, 9. So I know I have the right patient and I'm doing the right chest dressing. Okay, so first off, I'm just going to make sure that because the chest is connected to suction, so I'm just going to make sure that I check that the suction is connected properly. So I know this is the suction tube right here and it's connected to suction and it says connected to low, so suction is low there. So yeah, so the chest tube the suction is connected to low. I see it's connected to low and I know that's the case. So I'll just go around and do my other safety checks. So first I will just give the patient some privacy like I already did, and I'll just ask the patient if I can put his arm up to look at the dressing. So I'll just put my patient's arm up right here so I can expose the dressing.
So I have Jacob Morgan, the drug name insulin regular, the dose 100 units, volume 1 ml, diluent.
So now I have my patient's dressing exposed. I'll just inspect to see that it's intact, and as I see that the dressing is dry and intact, I will just use my clamps to make sure that there's no air leak in the clamp. So as I clamp, I will start climbing closer to the tube to make sure to check if those air leaks are going to stop. So as I climb here, I see that the air leak stops. I know that this is where the air leak is from. So when I do my dressing change, I know that should stop the air leak. So I will just go ahead, since I know that's where my air leak is, I'm just going to check the rest of the tube to make sure there's no kinking. I check down, see there's no kinking in the tube. And I also check my drainage box here, and I'll note the amount of drainage I see. I'll say I have about 50 milliliters of serosanguinous drainage, and I see to check for tidling as the patient breathes in and out, and I'll see to make sure there's tidling, and I also check to see the pressure mark to see that there's about 20 ml of water there. So I'm done all my safety checks. I also make sure to see that there is an emergency box with two clamps and normal saline. I see the clamps here, but I do not see any normal saline in the patient's room. So I will be bringing normal saline. So as I do this dressing change, I will bring in some normal saline to leave in the patient's room to make sure that if there's any emergency, he'll have normal saline in the room. So as I continue, I will then prep my sterile field for my dressing change. So I'll just wash my hands again.
I will wear a glove during this procedure, however, because I don't have it, a mask during this procedure, but because I won't wear it.
So I'll just
I'm just going to do a general
prepare my tray before I open the patient's dressing. So I can just ask the patient if this is okay to put this on his bed, and he's okay with that, so I'm just going to leave that on his bed.
I'm going to follow it to here. I'm going to turn it, it's going to go on R, and I'm going to leave it here.
Just make sure to maintain sterility throughout my procedure, and leave that on the patient's bed.
And now I'm just going to push on the end, and when I push on the end, it should go between 80 and 100.
And notice that I'm setting my tray in front of me and making sure that I can be able to walk between the patient and my sterile field without turning my back on the sterile field. So I just, and I'm putting it at a good level so that I can access it without breaking sterility.
Now I'm going to see my cold pot.
Okay, so I will then add some normal saline into my dressing for my cleaning of my.
The order was for 40%. So I'm just
wound.
going to see that it's 40% here, and that should be at 10
So I have
liters.
some normal
So I'm gonna make
saline.
sure the oxygen is up at 10 liters, but for the sake of the video, I'm going to turn it off.
And I also have my Jelonet that I'm going to add into this field for
Making sure that the flow
the chest tube dressing.
it is. And I'm also going to make sure I have my emergency equipment. So I have my normal saline and my sterile water. I have my ambu bag in case my patient needs help breathing. I have an extra cannula size, or inner cannula size 7.
So I have my normal saline and now I just need my.
Cup pressure dilators.
So now I can go ahead and open my wound and inspect it. So before that I'll just wash my hands again and then put on my gloves. And I'll be doing a non-touch clean techniques. So I'll be using clean gloves, but I'll make sure that nothing gets contaminated as I go through my procedure.
So now everything is good here. I'm going to take off. I'm also going to put an O2 monitor on him, so when I'm doing all my tasks that I know that he is not fatting.
So I will then open my chest tube dressing gently
Put on another pair.
and inspecting.
So it's looking pretty clean, but I'm gonna.
Just because I touched all that equipment, I'm just going to make sure it's all clean.
Noting any.
Now I will explain to the patient that I'm just going to be changing his trach dressing and his inner cannula, but before that I have to pre-oxygen
And
him.
just do this
and I also
gently
have
to make sure I don't dislodge the
So he can
chest,
breathe on his
the
own, so I'm
chest
just gonna
tube.
let him know to take some,
Making sure to
gonna
keep it
put up the
stable.
oxygen and take in 2 or 3 deep breaths. And just breathe gently. Okay, so I'm just going to turn this on all the way. Okay, so take 2 or 3 deep breaths.
So I will just examine this dressing and I see that it looks intact. There is no signs of bleeding or anything, and the wound site also looks intact. I will just discard that.
So now
There's no redness, no sign of infection. I can use this forceps to take out the Jelonet, and I also notice how it looks, and I'll just discard that, and I'll discard that as well. And at this point, I can discard these gloves and wash my hands to get new gloves as I'm going to be starting my procedure. And I also notice at this point that I don't have drain dressings in my tray, so before I put on my new gloves, I can just add that to my sterile field. Because once I put on the new gloves, I'm not going to be able
So now
to
I'm just going to first
adjust or add anything to my tray with those hands. So I'll just do that now. So I just add drain. So I just add those to my field, and then I can wash my hands again, and then put on my new gloves.
open up my sterile field. Okay, and I do realize this side went off, so I'm going to have to keep all my supplies on this side after. I'm just going to throw this into the garbage and make a garbage can
At
there.
this point, I'm going to start cleaning my
And
wound.
the patient said it's okay if I use his bedside.
I can just put this on the sides, making sure to maintain my 1-inch border with this.
Inside of the 1-inch
And I
border.
can use 2x2s to start cleaning around my
I don't want the
chest tube.
center part dirty, so I want to maintain sterility in the center.
I'm going to add my normal saline.
So I use a 2x2s, dip that in normal saline, strain it, and I'll clean around the dressing once and just put that in the garbage.
Now I'm just going to add
And then more 2x2s. And just clean that. Just one swipe on the other side, and that goes to the garbage. And then I can make another 2x2, and then I'll clean this time around. I'll go a little more outside, out of the wound, to make sure I clean the surroundings as well.
I'm going to open up one.
I'll just clean this a little bit outside, and then garbage that as well. And then I'll do that for the other side too.
So now I'm just going to open up my
Once,
cannula into my field.
and then click from the bottom outside. And I will just do one more time to clean the tube itself, because the tube will be covered with a dressing. So I want to make sure that I'm not covering any bacteria in there. Make sure everything is sterile before I put on my new dressing. Just clean this on the tube once, and I'll garbage it as well. And I can just use a 4x4 to dry around my wound, my chest tube site.
And now I'm just going to put on my
So I'll just use this dry one, go around it once.
So now
Then I'll
facing
just
everything,
use
make sure you
one last one to dry it.
to put on my
I'll just dry that side, and I'm all good. So now I can start putting on my dressing. I have to start with my Jelonet. So just peel up this Jelonet, and I can just put that up there. And the other side,
cannula, and I did wet it by a tiny bit. So I'm just going to take one of my
I'll just wrap this around so it can fit nicely around my chest tube.
Everything looks good.
put it in.
So at this point, I'm coming into the room
So I'll make sure I fully occlude the wound with the Jelonet to make sure no air is going in. You notice there was air coming out of there, so I'm just trying to fully occlude it so that there's no air going in.
the date of birth.
And I also remember to bring normal saline just in case of an emergency, because when I checked the safety there was no normal saline in. And then I'll put in the gauze dressing,
I
and then
know.
put the other one in another direction to make sure it's fully occluded.
Check. I wish I was this
And at this point I can just put a 4x4 on top of it. Once I have my 4x4, I can just put in my Nifex now. And prior to this, I already labeled this with my name, date and initials and time. So I'll just go ahead and put that on.
2,000. And at this point, it's the second check with the rate plugged in here. So second nurse can check this with me with the day
And
information,
then I'll put on the second one.
amino acids, 100 grams, dextrose 200 grams, lipid 50 grams. The rate is correct, peppers are correct.
And I've been making sure at this point to dent this
Is looking
so that if the patient pulls on it, it's not going to harm him. Okay. And then I can just cover the patient's dressing and put his arm back. And I will inform him to let me know if there's if he feels any discomfort or anything unusual. At this point, I will be starting my heparin infusion. So prior to this, I had an order, and the night nurse already primed the heparin and started it. So I'll just be checking it and starting it. But to do that, I also need to double check everything to make sure it's safe. First, I have to start with the patient's order. I'll ask my order nurse to pass me the doctor's order. I would have brought this to the patient's room.
making sure the patient's aware of what's happening.
So first, I will be checking my physician's order to the patient, to the MAR, and I have my physician's order. I have my physician's order here. So the patient is homeless Wendy, and PIN number is 123456, and the order is for heparin IV bag change, and it's heparin 25,000 units in D5W 2 ml 250 milliliters. Final concentration for this is 100 units per ml, and it says to start at a rate of 1350 units per hour. So I've checked that, and it says it's an initial infusion here, 1350 units per hour. So that's the rate at which I will be administering this, and there's no loading dose, and adjustment will be done later as the patient goes through this. So I can just take my MAR to the patient's room and double check that with the patient's IV band first to make sure I have the right patient. So Wendy Homeless, can you please tell me your name? So the patient will tell me their name, and I'll double check the phone number 1, 2, 3, 4, 5, 6, 7, 8, 9. So I'm going to be studying your heparin. As the nurse told you, this is to prevent blood clots, and I will just, she already prepped and started, so I'll just be studying this infusion. So I'll go ahead and double check my heparin bag here to make sure that I have the right bag. So I see here is heparin in 5% dextrose, which is as in the MAR, and it's 25 units and a total volume of 250 ml. And I'll just check the expiry date. I see it expires in August 2014, so I know it's not expired, and I have so I've just basically done all my checks, and at this point I will check the tube to make sure that it's going to be going in at the right tube. I will make sure that this will be going in the right tube, and at this point I can get my second nurse to double check all of this with me, to double check all of this as well, because it's a high alert medication. So at this point I'll get the second nurse, and the second nurse will basically go over all those checks again. So starting by making sure that it's the right patient, we'll check Homeless Wendy and the PIN number, and make sure it's the right medication, and go through the MAR and the bag, heparin in sodium, sodium in 5% dextrose, and it's 25,000 units. Final concentration is 100 units per ml, and the final volume is 250. Make sure it's not expired, and it will be going in at the rate of 1350 units per hour. So that's the rate at which I will be setting in the pump. So I'll go to my primary here, and I will go to Colleague Guardian to select my heparin. So I have heparin VTE here, which is the one which we're giving, and I select my level. It's 25 units, and final volume is 25 milliliters. Concentration is 100 units per ml, and then the dose, the rate at the dose is
So now I've already created a label.
so the dose will be the dose will be 13 units 1,315 units per hour. That's the rate at which the patient will be running the infusion. So I'll put my rate here, 1350 units per hour, and at that dose the rate will be 13.5 milliliters per hour. So I have that already, and I can confirm my primary. And just before I start my IV, I will just go over my checking, making sure I check the patient and the bag. It's heparin, 25,000 units, 100 units per ml, and it's basically go over all the checks again. And then at this point I can infuse my heparin, and I'll be doing it in the subclavian vein. At this point I noticed that I did not bring an alcohol swab to the room, so I can just call the second nurse to grab me one, and I have an alcohol swab here. So I can, just because I'm accessing a blood site, I can just put on my gloves here, and I will clean my port and start my heparin. And I will also need a flush as well for this, and I can just ask a nurse to grab a flush for me, just to see if my side is patent and okay. So I have a flush here, and I have cleaned my side. I can just prime a flush here, and then I'll unlock this, and I'll back
So I'm gonna go to
prime.
the
See, I see blood, and then I can flush this, push pause,
turn this on as well. Follow the tube into here, make sure it goes.
and then now I can connect my heparin, which has been primed already.
And then it's just
And making sure that
And once I connect that, I can
And I
just
should
press
see that it
start
should
to
go
start my
between 80
heparin,
and
and I'll
120
just do
on
all the
here,
patient
which it
teaching,
says.
and I'll just watch
So
to
I'm just
see
gonna turn off for the sake of the video,
drops
and I'm gonna put it in my
as it's
slot.
dropping, and I will just tell the patient to let me know if they feel any discomfort, or if, and I'll just let them know the signs of symptoms, if they have any bleeding or if they see any marks like petechiae or anything, and that's it. Thank you.
I'm gonna turn it off.